has very, very little to do with making insurance affordable. It has more to do with making it accessible, but it is not anything that has specific elements that are going to make insurance affordable. In fact, I think that it's probably fair to say, based on the analysis of the bill that we've had a chance to look at since March, that it's probably going to, in the short term, increase the costs of health care. So as you can see, if we take away the co-pays and we take away the co-insurance and we take away the deductible capability of paying for some of that service with all of these mandated items, there's only one place left to have that dollar recouped, and that's in premium. So it's unrealistic for us to not understand that we're going to see an increase in premiums on the basis of the fact that the carrier now has to, it's something as simple as, as immunizations. If there's no co-pay with immunizations, it's pretty straightforward. If you used to pay $25 to go get your flu shot, now you pay $0 to get your flu shot. That $25 cost has to be picked up someplace else. And if you do the simple math, you divide it over 12 months, the premium on your insurance just went up by $2 because you no longer have a $25 copay. It's pretty straightforward stuff. Now they can stay on their parents' plan just as a dependent. So the 13-year-old is going to get treated just like the 26-year-old. So that means that the health insurance companies are going to have to figure out a way to cover these people till age 26 on a family policy rather than writing out a separate policy for them. So again, you can... Pardon me? Regardless of where they live, regardless of whether or not they're married, regardless of whether or not they're currently enrolled in school. We've all heard that one, as long as you're still in college, you can stay on your parents' plan. Now it doesn't matter, you're to age 26. The only criteria that's going to be set out is whether or not you have the ability to get insurance on your own. So if you go get a job and the employer offers you insurance, you can't stay on mom and dad's, you got to go get your own at that point. For those of you that are a little bit older, you might remember there was a Blue Cross and Blue Shield policy called Blue Million. It covered $1 million worth of care. No one was ever going to get to $1 million. In the last 6 months, I've had 2 people in my office who capped at $1 million worth of care on their Blue Million plans. And now that restriction is going to be lifted. There's going to be no lifetime limits. 2 types of exchanges. One is going to be for personal insurance, individuals that are not employed, and the other is going to be for employers. And it will act as the intermediary between the carriers and the employer for insurance. What's going to happen is that the exchanges are going to allow people to have a competing look. There are websites now where you can go on and compare insurance prices. Generally in other areas like health, or in auto and in homeowners, you can go get comparison shopping. Exchanges are going to basically do that same thing. You're going to be required to have all of the elements up there because you're going to have a basic policy and then you're going to have riders that are going to add on. Exchanges are going to do that. The bill mandates that they either be government run or that they be run by a not-for-profit. It appears in New York State, and this will shock all of you that have ever had anything to do with New York State, it appears that New York State would like theirs to be government run. Okay. It also appears, what's really going to happen, I'll kind of cut to the chase, what's going to happen is that employers are going to get told that you have a couple of choices. You can continue to maintain a health care plan for your employees. You can enroll them. You can take care of the changes. You can contract with the carrier. You can negotiate a plan. You're going to have underwriting requirements. You're going to have all of those kinds of things that you need to do just like it is today. Or you can pay a set amount of money to the federal government, hand your employee a voucher, and send your employee to the exchange.
Which is exactly what's going to happen.
Thank you.
Because healthcare is so ridiculously expensive from the employee side.
From the employer side. So the
that is exactly what's going to happen.
The employer is going to then, and it's going to particularly happen, our estimate is that it'll happen instantaneously for anybody that's got less than 500 employees. But basically this is a significant change in the way we're going to deliver health care to our employees and to our citizens.